Secretary Sebelius, I, of course, have to start with the Patient Protection and Affordable Care Act, which is not a simple piece of legislation, not simple to implement. But I wonder if you would tell us, as the implementation has been going along for 3 years now, what has been unexpectedly difficult and what perhaps has gone more smoothly than you anticipated when the President signed the law?
Well, I think that probably no one fully anticipated, when you have a law that phases in over time, how much confusion that creates for a lot of people. So that has been difficult. When the law was signed and people immediately did not get affordable health insurance, they were surprised and a lot were disappointed. But now understand that this is a gradual phase-in and the full implementation won't be until 2014. I think that the second thing that probably has been more difficult is just the politics. It has been relentless and continuous. And I would say, I think there was some hope that once the Supreme Court ruled in July, and then once an election occurred, there would be a sense that this is the law of the land, let's get on board, let's make this work. And yet we find ourselves still having sort of state-by-state political battles, and again, creating what I think is just a lot of confusion. It's very difficult when people live in a state where there is a daily declaration, we will not participate in the law, for them to figure out whether or not there are any benefits that they will actually have a right to access. And so getting that word out, setting up the infrastructure has been more complicated. I would say the good news is that we already have millions of people who are benefiting. We know that about 6 million young adults, and young adults were the second highest age group of uninsured Americans prior to the passage of this law. So about 7 million young people now are on their parents' plan, and that will continue on. And that was done almost overnight. We have millions of people, probably 70 or 80 million, who now have preventive services with no copays and no coinsurance and are taking advantage of that, whether they're in Medicare or in private insurance companies. Again, I think that was rolled out with very little fanfare. Medicare benefits have actually increased, so seniors are seeing a 50% discount on brand name drugs. They have better choices in Medicare Advantage and are paying lower prices. So some of those things are actually taking place, rolling out without, again, a lot of difficulty, and very exciting initiatives underway through our Innovation Center, which is kind of the research and development arm of CMS, which has never existed before. Testing ways to improve the quality of care and lower costs at the same time, and we've got some early, very promising results. So those pieces of the puzzle are working. We've got a really, I think, terrific framework, and now we have the last final big piece.